definition. There are various definition I write in this content. You can choose anyone. It is important for 2 marks. The bag technique is a tool making use of public health bag through which the nurse during his or her home visit can perform a nursing procedure with ease and deftness, saving time and effort with the end in a view or rendering effect nursing care. What is a it is commonly known as a bag technique. It is one of the tool making there is a use in a public health use in a public health through the nurse during a home visit. What are the content in the bag? We can performing a nursing procedure with the easily and deftness without teaching a patient. You can showing the technique the patient and family can easily understand and effort the end the view rendering effective nursing care. What is the main is bag technique is the effective nursing care should be given to the individual and community. There are 3 I can write. You can write in your notes. Next one is the bag technique is a procedure and techniques in which the nurse know about the effective utilization of a community bag for performing the procedure with the care during the home visit. The nurse know about the effective utilization of a community bag for performing the procedure with the care during a home visit. It is so easily you can understand. Next one is the objective. What are those? Objectives are to provide effective health services to family during a home visit. You should know about these. The provide effective nursing care and health services to family during a home visit. To prevent a cross infection, the nurse should know the nurse should not cross infection with the one family to the other family. The nurse should know the preventive measures and to develop skills about effective utilization of a bag during a procedure. The nurse should know the skills about what are the effective utilization of a bag and during the home visit also and during the procedure. Next one is a purposes. What are the purposes are important for the community health bag? To carry equipment and material needed for the home, school and industrial visit. You should know about this. To carry the equipment and material while during a home visit and school or industrial visit. To carry equipment and material that are needed to make a test and to demonstrate care such as a dressing, irrigation, injection, urine testing. Why we carry the equipment? To carry equipment, the material to procedure, to make a procedure and to make a test, to make a demonstration such as a dressing and irrigation, injection and a urine testing, etc. And next one is to perform a nursing procedure and blood and urine investigation during a visit. The nurse should know the procedure about a blood testing and the urine investigation during a visit. And very skilled professional need some tools to perform a procedure during a home visit. When during the home visit, the skilled professional need some extra tools performing the procedures. One is a principle for using a bag technique. There are so many. I wrote from 5 textbook. I refer 5 textbook to principle of using a bag technique, and you refer a 5 textbook. You know about the content very clearly and effectively. What is one is a cleanliness. The bag is its content must be kept scrupulously clean and ready for use at all time. The bag should be clean. The bag and its content should be clean while using the procedure. Perform hand washing each time before touching the bag. The nurse should hand washing before and after the procedure, and it prevent a cross infection. The nurse must avoid touching dirty. The nurse do not touch anything from there and here. avoid the touching. And next one is the contaminated equipment must be autoclaved to save and scopes. If there is a contaminated equipment, there should be autoclaved and safe and spores prevent from the spores. And next one is protect and take care of a bag. A well-made bag has been properly cared for should last for 8 to 10 years. Protect the care of the bag. The bag should be protected from the infection. The nurse should know about these steps. The bag techniques can be performed in a variety of ways depending on the agency policy and the home situation, or as long as the principle of avoiding transferring of infection is always observed. The nurse should always observe the avoiding a transfer of an infection is always observed. Next one is the bag technique performing a save time and effort. While during a procedure, the bag techniques are very important to save the time and effort. Bag technique performing the decrease the chance of cross infection. While during a bag technique performing, there is a decreasing in the chance of cross infection. The bag technique perform make it easy to provide a procedure during the home visit. It is one of the bag technique perform that it make easy to provide a procedure during a home visit. The content of bag. These are content. Those are right in these content is important. Others are there. I can just only fuse right in this. One is fetoscopy. Fetoscopy, it is one of the sound, the hearing the sound of the heartbeat of the babies and BP apparatus, spring balance, thumb forceps, brush, IR catheter, scissors, arterial forceps, mucus sucker, and a clinical and rectal thermometer. Items and a quality. How much items are needed for the community health bag? The plastic bag containing the only one, kidney bean 2, lotion bowl 2, pair of artery forceps 2, pair of descending forceps 2, pair of scissors 1, bowl lifting forceps 1 pair, gloves 1 pair, instrument box, syringe and needle 1, catheter tubing and clip 1, urethral catheters 1, spirit 1, fetoscopy, measuring tap 1, clinical thermometer 1, sparring balance 1, stock cotton sufficient and sterile gauze sufficient. These are contained in the community health bag.